Doctors and nurses, healthcare-acquired infections put both the patient and the health worker at risk of dangerous, life-threatening infections. Preventing and controlling them is up to you and I. Wash your hands or use hand sanitizer regularly. Remember the 5 moments of hand hygiene. Always use personal protective equipment, PPEs, and dispose of them appropriately. Gloves must be changed after use with each patient. Dress appropriately while on the wards or in the theater, but don't take ward coats or shoes to restaurants or homes. You may just be transporting dangerous infections. Clean shared patient equipment after every use. Don't touch or rest on hospital equipment unless required. Maintain strict asepsis when performing procedures and dispose of sharps appropriately. Insist on the availability of hygiene utensils and PPE at all times. Ask for monthly microbial surveillance reports for your wards or theaters to guide your use of empirical antibiotics. Avoid overcrowding your clinics and wards. They must be well ventilated with ample space. Follow respiratory hygiene and cough etiquette and request other health workers and patients to do the same. Remember that preventing and controlling infections is up to us. Our lives and the lives of many others depend on it.